Obesity, a presentation by Paige Geanopulous
Riley Alexander.
and Michael Dugan.
Our societal problem is that research indicates that a high number of adolescents consume large quantities of high-fat fast food, contributing to adolescent obesity, and there is a direct link between adolescent obesity and health problems later in life as adults. MAHA has been integral in helping the United States in modern politics to reduce obesity in children and adults, which began by RFK Jr. and has been implemented by President Donald Trump in his current term. From the MAHA website, it states that chronic illness in America has been increasing over the past 10 years and even more. Currently, there are over 500,000 diet-related health issues, 42% increase in obesity rates, and metabolic health at 12%. This is very concerning, and it is MAHA's aim to reduce these quantities as their term goes on.
Obesity is a problem within the U.S. mainly due to overconsumption of ready-made meals. These meals tend to be high in calories, fats, and sugars due to the low production value of the ingredients. Obesity is also a problem in the youth of America due to the lack of physical activity. Some communities may lack safe places for children to play and exercise, as well as school programs having less physical education than in past generations. Social and economic factors also play a part in the problem of obesity within the youth of America. Families with limited resources may find it challenging to afford healthy foods, or stress at home or school can sometimes lead to unhealthy eating habits. There are other factors that affect the societal problem, such as genetics and marketing to younger generations with unhealthy foods. We are interested in researching this topic as it poses many health risks with obesity, such as heart risks, diabetes, and cancers that can negatively impact life and be detrimental to the youth of America.
A lobbyist is an individual who advocates for a specific interest group or client by attempting to influence the actions of government officials. They often do so by providing research and creating presentations with condensed, convincing information in order to connect with and influence legislators. As well as this, lobbyists raise money for the causes they represent and use that financial power to attempt to influence legislators and the legislation they pass. Lobbyists act as the liaison between businesses and nonprofits, as well as the government, hoping to pass legislation according to the specific agendas of their clients. In 2024 alone, of the 5 companies that spent the most money lobbying, 2 of them were companies lobbying for policy surrounding national health and well-being: the Pharmaceutical Research and Manufacturers of America and the American Hospital Association at 3 and 4, respectively. Lobbying allows for the representation of a wide range of interests, ensuring that the government considers the needs of various sectors across society. This infects the writing and passing of public policy and subsequently the social change it generates. In the field of health, for example, lobbying can be pivotal in passing important legislation aimed to improve the well-being of our nation.
The Obesity Society is a scientific society dedicated to the study of obesity and its treatment. This was founded in 1982. Obesity Society publishes vital, peer-reviewed studies that lead to the fields in exploring scientific developments in all areas of research, including clinical investigations, obesity biology, and integrated physiology, pediatric obesity, epidemiology, and genetics. It is through this research that we have been able to uncover that in the United States, there are 66% of adults that are suffering from obesity. Meanwhile, worldwide, it's only 37%. And additionally, in children is 29% of obesity, while worldwide it is 14%. This is extremely concerning because of how small the United States is compared to the rest of the world, but how much larger it is in terms of rates of obesity. And it is currently MAHA's aim to reduce this.
In 2022, the leading U.S. organizations with a primary focus on obesity came together with the intention of addressing the various roadblocks that they had each faced in efforts to improve access to obesity treatment and the reduction of the stigma and bias surrounding this disease. The organizations were the Obesity Society, the Obese Action Coalition, the Obesity Medicine Association, the American Society for Metabolic and Bariatric Surgery, the Stop Obesity Alliance, and the Academy of Nutrition and Diabetics. As part of their discussion, they agreed that it would be beneficial to come to a consensus on the definition of obesity. Their discussions led to the development of the consensus statement: obesity is a high prevalent chronic disease characterized by excessive fat accumulation or distribution that presents a risk of health and requires lifelong care. Virtually every system in the body is affected by obesity. Major chronic diseases associated with obesity include diabetes, heart disease, and cancer. This gave them a shared starting point for how to talk about obesity, which is consistent with how other chronic diseases are discussed. As the core organizations that addressed obesity, they worked together to write this statement and have agreed to use it as the central point in their communications around obesity.
The Treat and Reduce Obesity Act, also known as the TROA, was introduced at the 113th Congressional Session in 2013 in an effort to mitigate the rapid spread of obesity and subsequently its adverse health effects across the United States. One of the major factors causing high national obesity rates is limited access to treatment options. In order to solve this issue, the TROA was introduced. This act aims to improve access to obesity treatments for Medicare beneficiaries. The treatment that the act targets is intensive behavioral therapy, also known as IBT. If passed, Medicare coverage would expand to encompass this kind of therapy under professionals who aren't primary care providers. Under current legislation, only treatment by these primary care providers are covered by Medicare, restricting overall access. The Obesity Society has been a strong advocate for this legislation, which would allow more healthcare providers to offer intensive behavioral therapy and FDA approved weight loss medications. This bill has supporters from all sides of the political spectrum. However, it is still somewhat controversial, and progress to pass it as a whole has been slow. The act was reintroduced in 2024 and is still being debated to this day. The Obesity Society continues to support the passing of this act, putting much of their effort into lobbying. The TROA promotes a healthier United States, a mission the Obesity Society is aligned with and works very hard to achieve.
The Medical Nutrition Therapy Act of 2023 significantly expand Medicare coverage for outpatient medical nutrition therapy to include a wider range of chronic conditions beyond just diabetes and kidney disease. This is extremely important because many of those who suffer from obesity can only afford the fast food that we have explained in our societal problem, and due to this low income cannot afford the medical expenses that obesity can be treated by. Additionally, it also seeks to authorize more healthcare providers like nurse practitioners and physician assistants to refer patients for these crucial services. This expansion intends to improve disease management and prevention, potentially lower long-term healthcare costs, and increase access to registered dietitian nutritionists for a larger population of Medicare beneficiaries. Ultimately, the Act recognizes the vital role of nutrition in managing various chronic illnesses and aims for a more holistic approach to patient care. Many do not recognize that obesity can be solved through diet and habits, and by implementing nurse practitioners and nutritionists, this could be solved, but because those are not covered under Medicare, it can be increasingly difficult for people to have access to that. So this act aims to allow people to have access who may not be able to afford it.
Topic of lobbyists. The Obesity Society stated that it connects with experts, government and non-government organizations, and the public to develop, influence, and promote vital policies and public positions. They state that lobbyists provide information and are able to specialize in knowledge about certain issues, and that they can share that information with lawmakers to help them understand the potential effects of a law. Lobbyists are able to represent specific groups of people. That way, the groups of people who want their voices heard are able to have a say in the laws being passed. They can help find a common ground, and sometimes lobbyists can help bring those grounds together and find a way to compromise with the lawmakers so everyone can agree on something or some way to compromise with the law or policy being passed. They play a vital part in the process and is considered the first part of the amendment is considered part of the First Amendment right to petition the government.
Although lobbying has many benefits, there is a downside to financial pressures influencing legislation. For example, critics of lobbying state that it acts as a breeding ground for corruption, allowing those with more funding to have more power, potentially passing legislation more beneficial to the organization lobbying and funding itself than the nation's well being. There are also conflict of interest issues when it comes to lobbying. Elected officials, during their campaign, promise to serve in the name of public good. Therefore, they are meant to represent the public interest. However, if lobbyists provide fiduciary benefits to pass specific bills related to specific issues, corrupt or not, there becomes a conflict of interest for the elected official. The interests of lobby groups may not be perfectly aligned with the interests of the general public. In this instance, critics of lobbying worry that legislators are more likely to pass lobbied legislation for financial reasons and financial motivations. Albert Einstein, although famously a physicist dabbled in political theory, once stated on lobbying, the results of these developments is an oligarchy of private capital, the enormous power of which cannot be effectively checked even by a democratically organized political society. All in all, lobbying can be greatly beneficial. It connects the ideas of organizations that, most of the time, want to make the nation better, with the very people tasked to write our legislation. However, when power falls into the wrong hands, and those hands are able to use mass amounts of money to influence very serious, real political decisions, corruption has the potential to propagate. In an ideal world, lobbying can be entirely beneficial to the progress of our nation. However, there are major cons when it is put into practice.
Well, my opinion on lobbyists is somewhat complex. I think in theory, lobbyists are a good idea, advocating for the people and the making of public policies. However, from what I've read and researched, it appears to be a very easily manipulated system. I think people should have a say in the policies being passed to a certain extent before it simply becomes a case of trying to please the minority. In the case of our societal problem with obesity, I do think it is a very important issue that needs to be tackled and an important subject that needs to be addressed, especially with the youth of America, with the major health effects that it poses. And it does, in some cases, simply be caused by genetics or economic or social status. However, for majority of the situation for Americans, it's because of their own personal health choices and lifestyles. And I think at that point, it shouldn't affect the government and it should more so be something that they have to work on in their personal lives, not something that they blame the government for or ask someone to advocate for them for, instead, just have to deal with it on their own.
All in all, my opinion stems from the original problem, in that in my town, we are fortunate enough to have access to education regarding how to eat and diets. Additionally, we can afford to have healthier foods. Meanwhile, in other communities, people are unable to eat anything other than fast food, and that leads to the obesity epidemic. I also believe that MAHA will help in decreasing obesity by decentivizing the capitalist idea of fast food is the only food if you're under working conditions, and additionally by banning things that are chemicals like red dye 40. A controversial opinion I have that I believe that lobbyists should push for is that nutritionists should fall under the umbrella of Medicare because it can stop a problem before surgery becomes necessary and can overall help the health of both adults and children, because if adults have the help that they need, they can implement that same philosophy for their children. And ultimately, I believe that going more into in-depth research through the NIH beyond just the Obesity Society could increasingly help awareness in the United States, especially with rising gluttony, especially with companies like Crumble Cookie and overall fast food chains that are trying to market themselves to children can really help people decrease their risk of having obesity. And like what MAHA is doing, banning dangerous chemicals that other places that are not the United States have also banned, such as in Europe and, like I said before, with red dye 40. Thank you.
My opinions about lobbying and its implications are a little bit complex. Throughout this presentation, we have talked a little bit about the good that it can cause, such as with acts like the TROA and the MNT, which are generating positive social change towards the health and obesity situation in America. However, as you just heard from me, there are potential cons, such as those conflict of interest issues with elected officials, as well as the certain financial benefits influencing policy in potentially corrupt ways. However, ultimately, I think that lobbying is a positive thing just because it really helps organizations connect with legislation and help get things done in an efficient way. I think like any kind of spread of information is a good thing. Therefore, I think that lobbyists taking information from the public and giving it to figures in government can have the potential to really generate positive social change. Therefore, I do believe that lobbying is a good thing.